The morning sun cast long shadows across the pristine floors of Metropolitan General Hospital as Sarah Mitchell adjusted her navy blue scrubs and checked her watch. 23 years of nursing experience had taught her that emergency rooms never slept, and today promised to be particularly challenging. The overnight shift had left behind a backlog of patients, and the day crew was already running behind schedule. Dr. Marcus Wellington strode through the automatic doors of the ER with the confidence that came from being the hospital's most celebrated trauma surgeon. His perfectly pressed white coat bore his name embroidered in gold thread, and his Italian leather shoes clicked against the polished floor with each purposeful step. At 38, he had already performed over 2,000 successful surgeries and had been featured on the cover of Medical Excellence magazine twice. Sarah was busy triaging an elderly woman who had fallen at home when she heard Dr. Wellington's voice rising above the usual hospital chatter. He was speaking to Dr. Jennifer Chun, the new resident who had just started her rotation in the trauma unit. "Listen carefully, Chun, Dr. Wellington said, his tone carrying the authority of someone accustomed to being obeyed without question. "In this hospital, there's a clear hierarchy that exists for good reason. Surgeons like myself make the life and death decisions. We've spent over a decade studying, training, and perfecting our craft. We carry the responsibility when things go wrong, and we deserve the credit when lives are saved." Dr. Chin nodded nervously, clutching her clipboard as she tried to absorb every word. She had heard about Dr. Wellington's reputation for excellence, but also about his demanding nature and sharp tongue. "Now, you'll notice that nurses like to offer their opinions," Dr. Wellington continued, glancing around the bustling ER. "Some of them have been here for years and think that experience gives them authority to question medical decisions. But remember, they're support staff. Their job is to follow orders, not to think critically about complex medical cases." Sarah's hands paused momentarily as she took the elderly patient's blood pressure. She had heard variations of this speech before, but it never failed to sting. Despite her 2 decades of experience, her advanced certifications, and the countless lives she had helped save, some doctors still viewed nurses as little more than assistants. "Take Nurse Mitchell over there," Dr. Wellington said, nodding in Sarah's direction without bothering to lower his voice. "She's been here forever, and I'm sure she thinks her experience matters. But at the end of the day, she's only a nurse. She changes bedpans, administers medications, and follows the treatment plans that we create. Important work, certainly, but not the same level of responsibility as what we carry." The words hit Sarah like a physical blow, but she maintained her professional composure as she finished with her patient. Around her, several other nurses exchanged uncomfortable glances. This wasn't the first time Dr. Wellington had made such comments, and, unfortunately, it probably wouldn't be the last. "Mrs. Patterson, your blood pressure is slightly elevated, but that's normal given your fall," Sarah said gently to the elderly woman, her voice remaining steady and caring despite the humiliation she had just endured. "Dr. Chen will be with you shortly to examine your ankle." As Sarah moved to her next patient, she couldn't help but reflect on her journey to this moment. She had joined the Army Reserve right out of high school, serving as a combat medic for 8 years while simultaneously earning her nursing degree through night classes and weekend programs. The discipline and life-saving skills she had learned in military field hospitals had shaped her into the nurse she was today. Dr. Wellington, meanwhile, continued his lecture to Dr. Chun, completely unaware of the irony that would soon unfold. "The key to success in trauma surgery is confidence in your abilities and trust in the established medical hierarchy. When you understand everyone's role and limitations, you can work more efficiently." The morning progressed with its typical controlled chaos. Sarah moved from patient to patient, her experienced eyes quickly assessing injuries, her steady hands providing comfort and care. She had learned to read the subtle signs that others might miss. The slight change in skin color that indicated internal bleeding, the barely perceptible shift in breathing that suggested a collapsed lung, the look in a patient's eyes that revealed pain they couldn't articulate. Around noon, the relative calm of the morning was shattered by the wail of approaching sirens. The paramedics' radio crackled to life with urgent updates about an incoming trauma case. A construction worker had been severely injured in an industrial accident, and the initial reports suggested multiple traumatic injuries that would require immediate surgery. Dr. Wellington immediately shifted into his professional mode, barking orders to prepare the trauma bay. Clear trauma room 1 immediately. I want X-ray standing by, and get surgical prep ready. Chun, you'll assist, and pay attention to everything I do. Sarah quickly joined the preparation, ensuring that all necessary equipment was available and functioning. Despite Dr. Wellington's earlier comments, she knew that successful trauma care required seamless teamwork from everyone involved, regardless of their title or position in the hospital hierarchy. Nurse Mitchell, make sure the blood bank has O-negative ready, Dr. Wellington ordered without making eye contact. And try to keep the family members out of our way when they arrive. Already done, Doctor, Sarah replied professionally. I've also contacted the anesthesiology team and confirmed that OR3 is standing by if needed. Dr. Wellington barely acknowledged her response, already focused on the approaching ambulance. As the paramedics rushed through the doors with their patient strapped to a gurney, the trauma bay erupted into controlled chaos. The construction worker was unconscious, his hard hat cracked, his work clothes torn and bloodied from the accident. What do we have? Dr. Wellington demanded as he pulled on his gloves. Male, approximately 45 years old, fell from scaffolding about 20 feet, the lead paramedic reported breathlessly. Possible head trauma, definite compound fracture of the left leg, and suspected internal injuries. He's been in and out of consciousness during transport. As Dr. Wellington began his initial examination, Sarah noticed something that made her heart skip a beat. Partially visible beneath the patient's torn shirt was a distinctive tattoo, an eagle perched on a skull with crossed rifles beneath it. It was a military insignia that she recognized immediately, but it was the smaller tattoo just below it that made her gasp softly. The numbers 127th Infantry were clearly visible, along with what appeared to be a date from 15 years ago. Sarah's mind raced as memories from her military service came flooding back. Could this possibly be someone from her past? Someone whose life she had once saved in a very different setting, under very different circumstances? Nurse Mitchell, I need those X-ray results now, Dr. Wellington snapped, interrupting her thoughts. Right away, Doctor, Sarah responded, forcing herself to focus on the immediate medical needs of the patient. But even as she worked efficiently alongside the trauma team, her mind kept returning to that tattoo and the possibility that fate had brought someone from her past back into her life in the most unexpected way. The patient's condition was serious but stable as Dr. Wellington worked methodically to assess the extent of his injuries. The compound fracture would require immediate surgical intervention, and there were signs of internal bleeding that couldn't be ignored. It would be a challenging case, the kind that Dr. Wellington thrived on, and that would likely reinforce his confidence in his own abilities. As the team prepared to move the patient to surgery, Sarah caught a glimpse of his face as they adjusted his position. Despite the years that had passed and the injuries he had sustained, she was now certain of his identity. This was Staff Sergeant David Rodriguez, a soldier she had served alongside in a forward operating base in Afghanistan 15 years ago. A man whose life she had saved under circumstances that Dr. Wellington could never imagine. The irony of the situation was not lost on her as she watched Dr. Wellington take charge of the case with his usual authority and confidence. In a few hours, he would likely save this man's life and add another success to his impressive record. But what he didn't know was that the only nurse he had dismissed so casually that morning had already saved this same man's life once before, along with the lives of his entire squad, in a situation where medical degrees and hospital hierarchies meant nothing compared to courage, skill, and quick thinking under fire. As Dr. Wellington performed surgery on Staff Sergeant Rodriguez, Sarah found herself transported back to a dusty forward operating base in Afghanistan 15 years earlier. The memories came flooding back with startling clarity, as if the intervening years had simply melted away. It was August 2010, and 28-year-old Army Reserve medic Sarah Mitchell was 3 months into her deployment. The heat was oppressive, reaching over 120 degrees Fahrenheit during the day, and the constant threat of enemy activity kept everyone on edge. She had volunteered for deployment after completing her nursing degree, wanting to serve her country and gain experience that would make her a better healthcare provider. Forward Operating Base Phoenix was a collection of temporary buildings, tents, and defensive barriers carved out of the harsh Afghan landscape. Sarah worked in the medical tent, treating everything from heat exhaustion and minor injuries to serious combat wounds. The conditions were primitive compared to any hospital, but the medical team had learned to improvise and adapt to save lives with limited resources. Staff Sergeant David Rodriguez was a squad leader in the 127th Infantry, responsible for leading patrols in the dangerous territory surrounding the base. At 30, he was a career soldier with 12 years of experience, known for his calm leadership and unwavering dedication to bringing his soldiers home safely. His squad consisted of 8 men, most of them young soldiers on their first deployment. Sarah had treated several members of Rodriguez's squad for minor injuries and illnesses over the months. They were good soldiers who looked up to their squad leader and trusted him completely. Rodriguez always made sure to check on his men personally whenever they visited the medical tent, and Sarah had come to respect his genuine care for their well-being. The relationship between the medical staff and combat soldiers was different from anything Sarah would later experience in civilian hospitals. Out there, rank mattered less than competence and mutual respect. The soldiers knew that medics like Sarah were the difference between life and death when things went wrong, and they treated her with a level of respect that would later make Dr. Wellington's dismissive comments particularly painful. "Doc Sarah," Rodriguez had said one day, using the affectionate nickname the soldiers had given her, "I wanted to thank you for taking such good care of my boys. Private Johnson told me how you stayed with him all night when he had that fever. That kind of dedication means everything to us." Sarah had been touched by his gratitude, but she simply saw it as doing her job. "They're all good soldiers, Sergeant Rodriguez. Taking care of them is what I'm here for." On the morning of August 15th, Rodriguez's squad was scheduled for a routine patrol to check on a village about 10 miles from the base. Intelligence reports suggested the area was secure, but in Afghanistan, no patrol was ever truly routine. The mission was to deliver medical supplies to the village clinic and assess the security situation in the area. Sarah was working in the medical tent when the first explosion shook the base. The sound was unmistakable, an improvised explosive device, probably targeting a vehicle. Within seconds, her radio crackled to life with urgent communications from the patrol. "Base, this is Romeo 7. We've hit an IED. Multiple casualties. We need immediate medical support and evacuation." The voice belonged to Rodriguez, but Sarah could hear the strain and urgency beneath his usual calm demeanor. She immediately began preparing for casualties, gathering supplies, and coordinating with the evacuation helicopter crew. But the next transmission made her blood run cold. "Base, Romeo 7. The road is blocked, and we're taking small arms fire from multiple positions. We cannot move the casualties to the extraction point. Repeat, we cannot move to extraction." The situation was becoming a nightmare scenario. The squad was pinned down by enemy fire with wounded soldiers who needed immediate medical attention. The standard protocol would be to wait for a quick reaction force to clear the area and establish security before sending in medical personnel. But Rodriguez's next transmission made it clear they didn't have that kind of time. "We have 3 urgent casualties. Johnson and Martinez are unconscious and losing blood fast. Thompson has a severe leg injury and is going into shock. We need medical support now, or we're going to lose them." Sarah felt her training and instincts take over. She had joined the Army Reserve not just to serve her country, but to save lives. The thought of young soldiers dying while she waited safely on base was unacceptable. She grabbed her medical bag and headed for the base commander's tent. Colonel Patterson was coordinating the response when Sarah arrived. "Sir, I need to go out there," she said without preamble. "They have 3 soldiers who won't survive long enough for us to clear the area and establish security." "Absolutely not, Medic Mitchell," the colonel replied immediately. "It's too dangerous. We'll send the QRF and get them out." "With respect, sir, by the time the QRF clears the area and we can safely extract the casualties, they'll be dead," Sarah argued. "I can get there in 15 minutes with a small security team." Every minute we wait reduces their chances of survival. The colonel studied her for a moment, recognizing the determination in her eyes. He knew she was right about the timing, but sending medical personnel into an active combat zone violated every safety protocol. The enemy has the high ground and clear fields of fire, he said. Even with a security team, it's essentially a suicide mission. Then, we make it a mission that succeeds, Sarah replied firmly. Those soldiers trusted us to be there when they needed us most. I won't let them down. After what felt like an eternity, Colonel Patterson nodded grimly. Take Corporal Stevens and Private Wilson for security. You have 1 hour to get in, stabilize the casualties, and get everyone to the extraction point 2 clicks south. If you're not there in 60 minutes, we're coming in with everything we've got. Sarah quickly gathered her medical supplies and met with her security team. The plan was simple but dangerous. They would approach the ambush site from an unexpected direction, provide medical care under fire if necessary, and help move the casualties to safety. The 15-minute ride to the ambush site felt like hours. Sarah could hear gunfire in the distance and see smoke rising from what was probably their disabled vehicle. As they got closer, she tried to push aside her fear and focus on what needed to be done. When they reached a position about 300 meters from the ambush site, Sarah could see Rodriguez's squad pinned down behind their damaged vehicle. The soldiers were returning fire, but their position was untenable. 3 figures lay motionless near the vehicle, the casualties Rodriguez had mentioned. This is as close as we can get with the vehicle, Corporal Stevens told her. We'll have to go the rest of the way on foot, and we'll be exposed. Sarah nodded, shouldering her medical bag. Let's go save some lives. The next 30 minutes would test every skill Sarah had learned as both a nurse and a combat medic. Moving from cover to cover under sporadic enemy fire, she reached Rodriguez's position and immediately began assessing the casualties. Private Johnson had taken shrapnel to his chest and abdomen and was bleeding heavily. Specialist Martinez had a head injury and was unconscious but breathing. Private Thompson's leg had been nearly severed by the explosion, and he was indeed going into shock from blood loss. Working under fire with limited supplies, Sarah performed medical miracles that would have impressed even Dr. Wellington. She established airways, controlled bleeding, and administered emergency medications that stabilized all 3 casualties long enough for the evacuation. Her calm professionalism under extreme pressure inspired confidence in the other soldiers and helped Rodriguez maintain control of his squad. Doc, you just saved their lives, Rodriguez told her as they prepared to move to the extraction point. I don't know how to thank you. Thank me by getting everyone home safe, Sarah replied, already focused on monitoring the casualties during their movement to safety. The helicopter evacuation was successful, and all 3 wounded soldiers survived to make full recoveries. Sarah received a Bronze Star medal for her courage under fire, but more importantly, she had proven to herself and others that being only a medic didn't limit her ability to save lives when it mattered most. Now, 15 years later, as she watched Dr. Wellington's skilled hands working to repair the injuries that Staff Sergeant Rodriguez had sustained in a construction accident, Sarah couldn't help but think about how circumstances had brought them all together again. The same man she had risked her life to save in Afghanistan was now depending on a surgeon who had dismissed her as only a nurse just hours earlier. The surgery lasted 4 hours. Dr. Wellington worked with his characteristic precision, repairing the compound fracture in Rodriguez's leg and addressing the internal bleeding that had been detected during the initial examination. Sarah assisted throughout the procedure, her experienced hands anticipating what instruments would be needed next, her keen eyes monitoring the patient's vital signs for any concerning changes. Dr. Wellington was undeniably skilled. Sarah had to admit that his reputation for surgical excellence was well-deserved as she watched him work. His technique was flawless, his decisions quick and confident. He successfully stabilized Rodriguez's condition and repaired the most serious injuries. By the time they moved the patient to the recovery room, it was clear that Rodriguez would make a full recovery. Another successful surgery, Dr. Wellington announced to the surgical team as he removed his gloves. The patient should be awake within the next hour or 2. Standard post-operative monitoring. And I want to be notified immediately if there are any complications. As the team dispersed, Sarah remained in the recovery room to monitor Rodriguez during his initial recovery period. This was routine for complex surgeries, but Sarah had volunteered specifically because she wanted to be there when he woke up. She wasn't sure if he would remember her after 15 years, but she felt a connection to this patient that went far beyond her usual professional responsibilities. Rodriguez began stirring about 90 minutes after surgery. His eyes opened slowly, and Sarah could see him trying to focus and understand where he was. This was normal after anesthesia, but Sarah knew the disorientation could be frightening for patients. "Hello, Mr. Rodriguez," Sarah said gently, moving into his field of vision. "You're in the hospital. You had an accident at work, but you're going to be fine." The surgery went very well. Rodriguez blinked several times, trying to clear his vision and focus on her face. When he spoke, his voice was hoarse from the breathing tube that had been used during surgery. "Nurse," he said uncertainly, Do I know you from somewhere? You look familiar." Sarah felt her heart racing. After 15 years, their paths had crossed again in the most unexpected way. She wasn't sure how much to reveal, especially since Rodriguez was still recovering from anesthesia and might not remember clearly. "My name is Sarah Mitchell," she said carefully. "You might recognize me from somewhere. How are you feeling? Any pain or nausea?" Rodriguez continued to study her face, and gradually, recognition began to dawn in his eyes. The years had changed them both, but some faces remain etched in memory forever, especially when they belong to people who saved your life. "Sarah Mitchell," he repeated slowly. "Medic Sarah Mitchell? From Afghanistan." Sarah smiled, tears beginning to form in her eyes. "Yes, David. It's me." The transformation in Rodriguez's expression was immediate and profound. Despite his pain and disorientation, his face lit up with joy and amazement. He tried to sit up, but Sarah gently pressed him back down. "Doc Sarah, I can't believe it's really you," he exclaimed, his voice stronger now. "What are the chances? After all these years, in a hospital in Chicago?" "Small world," Sarah said, laughing through her tears. "How have you been, David? It's been 15 years. 15 years, 3 months, and 12 days, Rodriguez said with surprising precision. "Not that I was counting, but that day in Afghanistan changed my life. You saved my life, and the lives of Johnson, Martinez, and Thompson. We never forgot what you did for us." Sarah felt overwhelmed by the emotion in his voice. She had often wondered what had happened to the soldiers she had served with, but the Army's personnel policies and the passage of time had made it difficult to stay in touch. "How are the others?" she asked. "Johnson, Martinez, Thompson?" "All good," Rodriguez replied, his eyes bright with excitement despite his recent surgery. "Johnson became a police officer in Ohio. Martinez went to college and became a teacher. Thompson started his own landscaping business in Texas. We all stayed in touch over the years. We get together every August 15th, the anniversary of that day. We call it our second birthday, the day Doc Sarah gave us our lives back." The emotions Sarah felt hearing this were overwhelming. She had thought about that day countless times over the years, but she had never known the long-term impact of her actions. To learn that these men had not only survived but thrived, and that they still remembered and honored what she had done, was more meaningful than any medal or recognition she had ever received. "I need to tell you something," Rodriguez continued, his voice growing more serious. "After that day, when I realized what you had risked to save us, I made a promise to myself. I promised that if I ever got the chance to tell people about what real courage looks like, I would tell them about you. About a nurse who risked everything to save soldiers she barely knew." At that moment, Dr. Wellington entered the recovery room to check on his patient. He was pleased to see Rodriguez awake and alert, which confirmed that the surgery had been successful and that there were no immediate complications from the anesthesia. "How are you feeling, Mr. Rodriguez?" Dr. Wellington asked in his professional manner. "Any pain or discomfort?" "I'm feeling great, Doctor," Rodriguez replied. "Thanks to your skill and this amazing nurse." "Dr. Wellington, I presume." "That's correct," Dr. Wellington said, clearly pleased by the patient's gratitude. "The surgery went very well. You should make a full recovery." "I appreciate that, Doctor," Rodriguez said. "But I need to tell you something about this nurse. Sarah Mitchell is not just any nurse. She's a hero. Dr. Wellington glanced at Sarah with mild interest, assuming Rodriguez was simply expressing typical patient gratitude for good nursing care. I'm sure Nurse Mitchell provided excellent care, Dr. Wellington said dismissively. Our nursing staff is well-trained in post-operative patient care. No, doctor, you don't understand, Rodriguez said, his voice growing stronger. She volunteered to enter an active combat zone under enemy fire because she knew we wouldn't survive without immediate medical attention. She risked everything to save soldiers she barely knew. Dr. Wellington's expression changed from polite interest to genuine surprise. He looked at Sarah with new eyes, clearly not having known about her military background or her service record. She performed emergency medical procedures under fire that kept 3 critically wounded soldiers alive long enough to reach proper medical care, Rodriguez continued. She received the Bronze Star for courage under fire, but more than that, she gave 4 young men the chance to live full lives, to have families, to make a difference in the world. Sarah felt embarrassed by the attention, but Rodriguez was not finished. The anesthesia had lowered his usual social filters, and he was determined to make sure Dr. Wellington understood exactly who he was dealing with. Doctor, I heard what you said this morning about nurses just following orders and not thinking critically about complex medical cases, Rodriguez said bluntly. But this nurse made life and death decisions under conditions that would have terrified most doctors. She saved lives when it mattered most, and she did it with courage that most people can't even imagine. Dr. Wellington's face flushed as he realized that his earlier comments had been overheard and were now being directly challenged by his patient. The authority and confidence he usually projected seemed to falter as he struggled to process this new information about Sarah. I wasn't aware of your military service, Dr. Wellington said to Sarah, clearly uncomfortable. That's quite impressive. The point isn't just her military service, Rodriguez pressed on. The point is that you dismissed her this morning as only a nurse, as if that somehow limited her abilities or importance. But this woman has more courage and skill than most people will ever have. She saved more lives under impossible conditions than most doctors will save in their entire careers. The recovery room fell into an awkward silence. Dr. Wellington was clearly struggling with how to respond to this unexpected revelation, while Sarah wished she could simply disappear. She had never wanted her past service to be used to embarrass anyone or to create conflict in her workplace. David, it's okay, Sarah said gently. Dr. Wellington is an excellent surgeon who just saved your life. Everyone here is just trying to do their job and help patients. But Rodriguez was not about to let the moment pass. The combination of post-surgical emotion, residual anesthesia, and 15 years of gratitude had created a perfect storm of honesty that wouldn't be easily contained. No, Sarah, it's not okay, he said firmly. People need to understand that being only a nurse doesn't mean what some people think it means. You deserve recognition and respect for who you are and what you've done. You've earned it 100 times over. Word spread quickly through Metropolitan General Hospital. Within hours of Rodriguez's passionate defense of Sarah, the story was being whispered in hallways, discussed in break rooms, and shared across departments. Healthcare workers have their own informal communication network, and news this significant traveled fast. Dr. Wellington found himself in an increasingly uncomfortable position as the day progressed. Nurses who had previously been deferential began looking at him differently. Residents and medical students seemed less impressed by his usual authoritative pronouncements. The respect he was accustomed to receiving felt forced rather than genuine. Around 6 o'clock that evening, Dr. Wellington was reviewing patient charts when Dr. Patricia Hendricks, the chief of staff, knocked on his office door. Dr. Hendricks was a woman in her 50s who had earned her position through decades of exceptional medical service and strong leadership. She was known for her fairness, but also for her unwillingness to tolerate behavior that undermined the hospital's collaborative culture. Marcus, do you have a few minutes? Dr. Hendricks asked, stepping into his office and closing the door behind her. Of course, Dr. Wellington replied, though the serious expression on her face suggested this wouldn't be a pleasant conversation. I've been hearing some interesting stories today about comments you made this morning regarding our nursing staff, Dr. Hendricks said without preamble. Specifically about Sarah Mitchell. Dr. Wellington felt his stomach sink. He had hoped the incident would simply blow over, but clearly that wasn't going to happen. I was simply explaining to Dr. Chun about the importance of maintaining professional hierarchies, he said defensively. Clear roles and responsibilities are essential for effective patient care. Marcus, I've known you for 8 years, Dr. Hendricks replied calmly. You're an exceptional surgeon, and this hospital has benefited greatly from your skills. But what I heard described today wasn't about professional hierarchies. It was about disrespecting dedicated healthcare professionals based on their job titles rather than their abilities or contributions. Dr. Wellington started to respond, but Dr. Hendricks held up her hand to stop him. Let me tell you what I know about Sarah Mitchell, she continued. She's been with this hospital for 12 years. In that time, she's received 3 excellence awards, completed advanced certifications in trauma nursing and emergency care, and has been specifically requested by families whose loved ones she's cared for. She's trained dozens of new nurses and has served on multiple hospital committees that have improved our patient care protocols. Dr. Wellington listened uncomfortably, realizing he had never bothered to learn much about Sarah's background or qualifications. But more than that, Dr. Hendricks continued, I just spent an hour learning about her military service. Did you know she received the Bronze Star? Did you know she voluntarily entered combat zones to save wounded soldiers? Did you know she saved lives under conditions that would challenge the most experienced trauma surgeon? I wasn't aware of the details of her background, Dr. Wellington admitted quietly. That's exactly the problem, Dr. Hendricks said firmly. You made judgments about her value and capabilities without knowing anything about her qualifications, experience, or character. You reduced a decorated veteran and highly skilled nurse to a stereotype based solely on her job title. Dr. Wellington felt genuinely ashamed for the first time in years. He had always prided himself on his professionalism and medical judgment, but he was forced to admit that his behavior that morning had been neither professional nor well-informed. I spoke inappropriately, he said finally. I should have been more respectful. Marcus, this goes beyond inappropriate comments, Dr. Hendricks replied. This is about fundamental respect for colleagues and understanding that excellent patient care requires collaboration among all healthcare professionals, regardless of their titles. Sarah Mitchell has probably forgotten more about emergency medical care than most doctors will ever learn. The conversation was interrupted by a knock on the door. Dr. Hendricks opened it to find 3 men in their 40s, all wearing casual civilian clothes, but carrying themselves with the unmistakable bearing of military veterans. Excuse me, one of them said politely. We're looking for Dr. Wellington. We understand he's the surgeon who operated on David Rodriguez today. I'm Dr. Wellington, Marcus said, stepping forward uncertainly. Sir, I'm Michael Johnson, and these are my friends Tony Martinez and Bill Thompson, the man said. We served with David Rodriguez in Afghanistan, and we understand that you saved his life today. We wanted to thank you personally. Dr. Wellington was still processing this when Johnson continued. We also wanted to ask about the nurse who was taking care of David. Sarah Mitchell. We understand she works here. Yes, she's one of our nurses, Dr. Wellington replied, wondering where this conversation was heading. Sir, Sarah Mitchell saved all of our lives in Afghanistan. Martinez spoke up. We've driven here from 3 different states because when David called to tell us what happened, he also told us that he'd found Doc Sarah after all these years. We call her Doc Sarah because even though she was officially just a medic, she was the best medical professional any of us ever served with, Thompson added. She risked her own life to save ours, and we've never forgotten that. Dr. Hendricks watched this exchange with interest, seeing another piece of the puzzle falling into place. We heard that someone at this hospital said she was only a nurse, Johnson said, his voice carrying an edge that suggested he didn't appreciate that characterization. We wanted to make sure that whoever said that understood who they were talking about. Dr. Wellington felt the weight of multiple stares and realized that his casual dismissal of Sarah that morning was going to have consequences he had never anticipated. That someone was me, he admitted reluctantly. And I realize now that I spoke without understanding who I was talking about. Dr. Wellington is an excellent surgeon who saved David's life today, Dr. Hendricks interjected diplomatically. I believe he's gained a new appreciation for the backgrounds and qualifications of all our healthcare professionals. The three veterans exchanged glances, clearly sizing up Dr. Wellington and trying to decide how to respond to his admission. "Doctor, we don't want to cause problems for anyone," Martinez said finally. "But Sarah Mitchell is family to us. She's the reason our wives are not widows, and our children are not orphans. When someone disrespects her, they're disrespecting something sacred to us. We understand that hospitals have hierarchies and protocols," Johnson added. "But courage, skill, and dedication to saving lives shouldn't be dismissed because of someone's job title. Sarah Mitchell has more of all three than anyone we've ever known." Dr. Wellington found himself in the unusual position of being lectured by patients' family members about the qualifications of his own nursing staff. It was humbling in a way he had never experienced. "I would very much like to apologize to Nurse Mitchell," he said sincerely, "and to learn more about her background and service." "That would be appropriate," Thompson said. "But you should know that Sarah would never want special treatment because of her military service. She's always been about the work, not the recognition." After the veterans left to visit with Rodriguez, Dr. Hendricks remained in Dr. Wellington's office. "Marcus, this is a teaching moment," she said gently. "Not just for you, but for all of us. We work in an environment where people's lives depend on our ability to function as a team. When we create artificial barriers based on titles or assumptions, we undermine that collaboration." "I understand that now," Dr. Wellington replied. "I need to make this right." "You do, Dr." Hendricks agreed. "But more than that, you need to understand that this hospital succeeds because we have exceptional people in every role, from housekeeping to surgery. Sarah Mitchell is just one example of the dedicated professionals who make this place work." As Dr. Hendricks left, Dr. Wellington sat alone in his office, contemplating how much his perspective had changed in a single day. He had always believed that his surgical skills and medical training made him the most important person in any medical situation. But today he had learned that courage, experience, and dedication couldn't be measured by job titles or medical degrees. He realized that his dismissive attitude toward nurses wasn't just disrespectful, it was professionally short-sighted. Some of his best surgical outcomes had been the result of nurses whose experience and observations had prevented complications or identified problems he might have missed. For the first time in his career, Dr. Marcus Wellington began to understand that being at the top of the medical hierarchy didn't mean he was the only person whose contributions mattered. And he knew that tomorrow, he would need to find the courage to apologize to a nurse who had more real courage than he had ever possessed. The next morning, Dr. Wellington arrived at the hospital earlier than usual. He had spent most of the previous evening thinking about how to approach Sarah, and he knew that a simple apology wouldn't be sufficient. His comments had been heard by multiple people, and his changed perspective needed to be demonstrated publicly, not just expressed privately. Sarah was in the middle of her morning rounds when Dr. Wellington found her. She was checking on an elderly patient who had undergone hip replacement surgery, adjusting his pillows, and ensuring he was comfortable. The gentle way she spoke with the patient and the thorough attention she paid to his concerns demonstrated exactly the kind of professional caring that Dr. Wellington had failed to appreciate. "Nurse Mitchell," Dr. Wellington said as she finished with the patient, "could I speak with you privately for a moment?" Sarah nodded, though she was clearly apprehensive about what this conversation might involve. They walked to a quiet area near the nurse's station where they could talk without being overheard. "Sarah," Dr. Wellington began, using her first name for the first time, "I owe you a sincere apology for my comments yesterday morning. What I said was disrespectful, uninformed, and completely inappropriate. I'm truly sorry." Sarah was surprised by the genuine contrition in his voice. She had expected perhaps a brief, formal apology, but his tone suggested something deeper had changed. "I appreciate that, Dr. Wellington," she said carefully. "Please, call me Marcus," he replied. "And I need you to know that I've learned some things about your background that make me ashamed of how I characterized your role here. Your military service, your Bronze Star, your courage under fire. None of that should have been necessary for me to treat you with respect, but learning about it has opened my eyes to how wrong I was." Sarah felt uncomfortable with the focus on her military service. She had always believed that all healthcare workers deserved respect regardless of their backgrounds, and She didn't want to be seen as deserving special treatment. "Marcus, I appreciate your apology," she said sincerely. "But I hope you understand that every nurse here deserves respect, not just those with military backgrounds. We all chose this profession because we want to help people heal." Dr. Wellington was struck by her response. Even while accepting his apology, she was advocating for her colleagues rather than focusing on herself. It was another indication of the character he had failed to recognize. "You're absolutely right," he said. "And that's something else I need to address." Later that morning, Dr. Wellington did something unprecedented. He called a meeting of the entire emergency department staff, doctors, nurses, technicians, and support personnel. It was unusual for surgeons to address the entire department, and people were curious about what he wanted to discuss. "I asked everyone to come together because I need to address something important," Dr. Wellington began, standing in front of the assembled group. "Yesterday morning, I made comments about the role of nurses in our hospital that were disrespectful and inappropriate. Specifically, I characterized nurses as support staff whose job is simply to follow orders without thinking critically about medical cases." There was an uncomfortable silence as people realized what was happening. Public apologies from senior doctors were rare, and many staff members weren't sure how to react. "I was wrong," Dr. Wellington continued. "Excellent patient care requires collaboration among all healthcare professionals, and that collaboration depends on mutual respect. Our nurses bring years of training, extensive experience, and critical thinking skills that make all of us better at what we do." He paused, looking directly at Sarah before continuing. "I also want to acknowledge that I made these comments about Sarah Mitchell specifically, characterizing her as only a nurse. I've since learned that Sarah is a decorated military veteran who risked her life to save wounded soldiers in Afghanistan. But her military service, impressive as it is, isn't what makes her deserving of respect. What makes her deserving of respect is the same thing that makes all of our healthcare professionals deserving of respect: their dedication to healing and their commitment to excellent patient care." The response from the staff was immediate and positive. Nurses who had felt devalued by his previous comments smiled and nodded their appreciation. Other doctors began to applaud, recognizing the courage it had taken for Dr. Wellington to make this public acknowledgement. "Going forward, I want to make sure that everyone in this department understands that we succeed as a team," Dr. Wellington concluded. "Every role is important, every perspective matters, and every healthcare professional deserves to be treated with dignity and respect." As the meeting dispersed, several nurses approached Dr. Wellington to thank him for his words. Dr. Chun, the resident who had been the audience for his original inappropriate comments, also stopped to speak with him. "Dr. Wellington, I really appreciate what you just did," she said. "As someone just starting my career, it's important for me to understand how to work collaboratively with all healthcare professionals." "That's exactly right, Dr. Chun," he replied. "And I apologize for setting a poor example yesterday. The best doctors are those who recognize and appreciate the expertise of everyone they work with." Later that afternoon, Dr. Wellington visited David Rodriguez, who was recovering well from his surgery. The 3 veterans who had come to visit the previous day were still there, having taken time off work to support their friend and former squad leader. "Dr. Wellington," Rodriguez said warmly as the surgeon entered the room, "I heard about what you did this morning. That took real character." "It was the right thing to do," Dr. Wellington replied. "And I owe you an apology as well. I should have listened more carefully when you tried to tell me about Sarah's background yesterday." "No need to apologize," Dr. Johnson interjected. "We all make mistakes. What matters is how we handle them afterward. Taking responsibility publicly the way you did today shows real leadership." Dr. Wellington was touched by their generosity, especially given how protective they clearly felt about Sarah. "I want to ask you something," Martinez said. "Would you be willing to tell us more about how the surgery went yesterday? We know Sarah was assisting, and we'd love to hear about how she performed in the operating room." Dr. Wellington was happy to discuss the surgery, and as he described the procedure, he found himself praising Sarah's assistance without even thinking about it. "She anticipated what instruments I would need before I asked for them," he said. "Her monitoring of the patient's vital signs was flawless, and she noticed a slight change in blood pressure that helped us adjust our approach. She's clearly an experienced and skilled surgical nurse. That sounds like our Doc Sarah, Thompson said with pride. Always thinking ahead, always focused on what needs to be done. As their conversation continued, Dr. Wellington began to understand the deep bond that existed between these men and Sarah. They weren't just grateful patients. They were a brotherhood that had been forged in combat and strengthened by shared experience. Sarah was part of that brotherhood, and their loyalty to her was absolute. Over the following weeks, Dr. Wellington's relationship with the nursing staff improved dramatically. He made an effort to learn about his colleagues' backgrounds and qualifications, and he began to appreciate the depth of knowledge and experience they brought to patient care. He also changed his teaching approach with residents and medical students, emphasizing collaboration and respect for all healthcare professionals. Sarah, meanwhile, found that the incident had brought unexpected positive attention to the nursing profession at Metropolitan General. Other departments began to adopt Dr. Wellington's collaborative approach, and the overall culture of the hospital became more respectful and inclusive. 3 months later, Dr. Wellington nominated Sarah for the hospital's Excellence in Nursing Award, writing in his nomination letter, "Sarah Mitchell embodies everything we should value in healthcare professionals: clinical expertise, professional dedication, and the courage to do what's right when lives are at stake. She makes every doctor she works with better, and every patient she cares for safer." When Sarah received the award at the hospital's annual recognition ceremony, Dr. Wellington was in the audience, applauding enthusiastically. Also in attendance were David Rodriguez and his 3 squad mates, who had driven to Chicago again to support the woman who had given them their lives back 15 years earlier. In his brief acceptance speech, Sarah said something that summarized the lesson everyone had learned. Excellent healthcare isn't about hierarchy or titles. It's about people working together with skill, dedication, and respect for each other. When we remember that, we can accomplish amazing things. Dr. Wellington had learned that being a great doctor wasn't just about surgical skill or medical knowledge. It was also about recognizing and appreciating the contributions of everyone involved in patient care. He had discovered that the phrase, "only a nurse," was not just wrong. It was a fundamental misunderstanding of how healing actually happens. And Sarah had been reminded that the respect and brotherhood she had earned in military service could be found in civilian healthcare as well, among people who understood that saving lives is a team effort that requires the best from everyone involved. The story of their conflict and reconciliation became part of Metropolitan General's culture, a reminder that respect must be earned through character and actions, not demanded through titles or position. It was a lesson that made everyone there better at the work they had all chosen to do, the sacred work of healing.